Hi, I'm Riz Khan. Welcome to the show. 5 years ago, the world changed overnight. Streets emptied, doors shut, and uncertainty loomed for half the population of the planet living under lockdown. What began as a temporary measure to control a global pandemic turned into a defining period of our lives. We're still living with the social and economic repercussions of that time and learning more about its physical and mental legacy. And questions remain. Was it all worth it? Did lockdowns really save lives? Why did health experts make a U-turn on how to tackle the pandemic? Did world leaders make the right decision on whom to save? And how did the situation contribute to political polarization and a lack of trust that continues to this day? Well, two Princeton University political scientists have tackled some of these provocative questions in a new book. In COVID's wake, how our politics failed us. Well, the answers the professors came up with will make uncomfortable reading for some of the people in power during the pandemic. Later in the show, I'll speak with Professor Steven Macedo, but I'll start with his co-author, Professor Francis Lee. Professor Francis Lee, I'm glad you could join us for the show. Now, this is such a sensitive issue with quite strong feelings on both sides, sometimes with kind of threatening arguments on one side. And I wonder to what degree you had to think about the potential backlash to your academic career in tackling this particular subject.
I was concerned about it initially, knowing that there's been so much emotion wrapped up in all of these issues. And, it was clear that academics who had raised questions about the pandemic response often were subjected to reputational attacks. So there was some hesitance in taking on the topic. But as we've completed the book and since it's been published, what we've discovered is that in many ways we're just pushing on an open door, that there is a willingness now to revisit the decisions of the past and to reflect on them. And that is, in the end, what the book is. It's an early history. We take a look at, the decisions that were made and what the consequences were of a, very critical period in U.S. and world history.
It is interesting to discover, though, that these non-pharmaceutical intervention models date back as far as George W. Bush's presidency. What did you discover about that?
So in the aftermath of 9/11 and the anthrax attacks on the U.S. Congress, there was a heightened awareness of issues of biosecurity. George W. Bush, during a summer vacation, read a book about the 1918 pandemic flu, and he asked members of his Homeland Security team to start working on a pandemic plan. And so they began to pull together experts who could help to game out scenarios for responding to a crisis of that nature so that we wouldn't be as unprepared as we had been in 1918. And some of those advisors began to turn to and produce, some of them produced and some of them turned to academics who were producing models that suggested that non-pharmaceutical interventions could work. They also took a look back at 1918 and argued that cities in the U.S. that had imposed closures of theaters and other public gatherings, that they fared better in the 1918 pandemic. So that was out there. Now, of course, those ideas were also very controversial among public health officials. So when George W. Bush's advisors went to CDC with these ideas, they found a cool reception. And so the Department of Health and Human Services commissioned a study to be conducted by what was known then as the Institute of Medicine, now the National Academy of Medicine, to take a look at those models. And they examined them carefully and they looked at the data and they found it rather equivocal. They pointed to the high costs that would attend these measures, and they declined to endorse this kind of a strategy. So this had been examined and this was out there. Now, the advisors, of course, wanted to have something to offer the president to say, well, this is something we can do. And so there it was on the shelf. And so those ideas were present. at the time the COVID pandemic broke out in 2020. These ideas had been circulated, but they had not been embraced. There had been, in fact, a recent study in 2019 by the World Health Organization that reviewed the evidence base around each of the proposed non-pharmaceutical interventions, meaning masking, business closures, school closures, testing and tracing, all the various measures that were taken to try to stem the spread of the disease. And they rated all of those measures as having poor evidence. And in the case of several of them, they recommended them not to be used under any circumstances in the context of a respiratory pandemic. Among those were contact testing and contact tracing, quarantine, and border closure. And yet, 6 months later, all of those measures would be deployed globally against COVID, with policymakers saying that they were following the science, even though the evidence base had not previously been judged as being there for such stark claims about what the science would tell us to do under these circumstances.
And then, of course, when China did its lockdown of its province that included Wuhan, it looked like a blueprint for everyone else to follow. So what happened there? Why did that suddenly seem to be the right way to go?
That's right. So Wuhan imposed these sweeping measures, unprecedented measures. I mean, the initial reaction of public health officials in the US to the Wuhan lockdown was that this was mind-boggling. They had never imagined a response of this scale. And then you begin to see cases come down. You begin to see people in Wuhan taking down the temporary hospitals that they had built to handle the crush of demand as that pandemic wave hit. So they could see the lockdown and then the decline of cases and death. And so on the basis of that World Health Organization report recommended the strategy to the whole world without exception. And strangely, there were not skeptical voices pointing out that based on prior experience with pandemics, we knew that they come in waves. And that prior pandemics had been characterized by waves that hit different places at different times and then repeatedly do so. And so there was no basis for confidence that this was the end of the story in Wuhan. And yet there was a jumping to conclusions about what to do in the context of the initial Wuhan experience.
Now, Professor, even if people were wary of information coming out of China, as is often the case in the West, Italy then had was the first democratic country, I guess, to create its own lockdown policy. And that seemed to reinforce what China was doing, didn't it?
Absolutely. The Italian lockdown, which was the first nationwide lockdown, demonstrated to democracies around the world that it was possible to impose measures such as lockdowns in a democratic country, and that they would be popular. And in fact, there was a great clamoring for a similar action in other countries as they looked to what was being done in Italy. In the US, when the lockdowns were initially imposed in mid-March of 2020, they were hugely popular, with polls showing 87% of Americans approving, which is a remarkably high approval rating in a country that is characterized by a lot of political polarization.
It is interesting also that there were a number of influential reports that came out of places like the UK and elsewhere that said that lockdowns could be a very effective way to flatten the curve, allowing healthcare systems to kind of cope with the huge jump in infections and perhaps recover their ability to handle it. So it did seem like a good idea there as well.
That's right. So that Imperial College Report number 9, which was officially published on March the 16th, that's the same day that the coronavirus task force in the U.S. began to recommend lockdowns to the United States, to governors across the U.S. But Neil Ferguson had been a longtime collaborator of those same George W. Bush advisors who had been working on mathematical models for controlling the spread of a pandemic disease. So he had a long track record of working in that space and being an advocate of those measures. even though those measures were controversial in public health more generally. But his report showed, just dire projections of what would happen in terms of the fatalities from the disease if such measures were not taken. For the U.S., the projection was 2 million deaths by August of 2020. So if these measures were not taken, but if they were, the model suggested considerable mitigation would occur. So policymakers, felt tremendous pressure to do something along the lines of what the report recommended, because it seemed to say if you didn't, then far more people than necessary would perish.
It's interesting when you said earlier that opinions seem to be very much in favor of lockdowns. Ironically, in especially in the USA, in a country where polarization in opinion is quite common. So, did opinions just fall in line, or were there a notable number of voices arguing against it?
There were some initial skeptics in March and early April in opinion outlets. Now, the polling showed that the measures were popular, but there were some skeptical voices early on. As reopening began to get started in the U.S., which that the lockdowns, of course, were not sustainable for the whole time period until vaccine was available in any country. And in the U.S., those initial lockdowns lasted about a month in Republican states and about a little over 2 months in Democratic states. So as there began to be some debate about reopening, you begin to see in opinion outlets, so in the broader, you say it's the elite discourse that policymakers read, that the news magazines, the newspapers, the editorials, just a shutting down of debate around the measure. So it's very interesting that initially in March there was some questioning, then the measures are implemented. And then after that, we characterize as sort of a turn on a dime among experts at that juncture, experts, opinion leaders, where it just became sort of anathema to raise questions about the effectiveness of those measures beginning in summer of 2020. And the disdain for raising such questions lasted for a long time and was something that was still in the background as my co-author and I began undertaking the research for this project, concern about whether or when people would be ready to ask these questions again. So it's an interesting story of perceptions and of policy debate and consideration of policy alternatives and questions around democratic deliberation, in addition to the questions around the science of pandemic management.
And I'm guessing the situation also, the dynamic changed when we started to see presidents and prime ministers holding regular press briefings alongside scientists such as Dr. Anthony Fauci in the USA, where everyone was assured that the policy was to follow the science. As the term became very well known. How did that strategy develop?
Well, I think for political leaders in the U.S. And in other places, it was easy to sort of hide behind their expert advisors. I mean, these were highly consequential decisions with devastating effects on society. And it was much easier for them to say that what they were doing was merely following expert advice. And so in order to sustain that, it was necessary to make sure that dissenting voices among scientists didn't get much of a platform. And so you then began to see efforts to suppress such questions on social media. And an editorial line maintained quite tightly at the major newspapers, raising sort of making such questions off limits.
Was it hiding behind the science, the scientists, or were they actually putting their trust into the scientists? And perhaps were they even ducking their political responsibility and accountability?
I think they were ducking their political responsibility and their accountability, in the sense that there were obviously questions that were not being asked, such as when In the US, when states began to reopen, the models projected that there should be a resurgence of the disease. And yet it didn't necessarily happen that way. That the models were not as powerful in predicting the course of the disease as they were portrayed to be early on in the crisis. So the problem that we are pointing to in the book is not just of those initial decisions, but of future and subsequent decisions over the course of what turned out to be a lengthy crisis, where more information was being obtained all the time. Information that called into question some of those earlier decisions, and yet there was a resistance to reconsidering.
Is there any defense for the political leadership that perhaps public panic had set in and they were under a lot of pressure in order to find a solution?
That's a fair point, absolutely, that the public trusted the scientists. The way that the whole issue got framed for the public in the news media was often that there's the scientists here on one hand, and then there's the politicians on the other. Who do you trust? Publics in any democracy have a reasonable amount of skepticism about political leaders. Scientists are not subjected to the same degree of skepticism and are seen as having less by way of conflicts of interest. So there was a preference to believe the scientists relative to the politicians.
Now, of course, lockdown affected people in very different ways. And I wonder how that one size fits all strategy had an impact on people in terms of, how they handle the epidemic, irrespective of their geographic positioning, their social status. There were so many factors that could change people's experiences of the lockdown.
That's right. Well, when we took a look in the book at what was known about the costs of the measures that were taken, there are systematic ways in which those costs fall more heavily on the less advantaged in society. Beginning with the fact that not everyone could lock down at all. About a third of the workforce in the U.S. were essential workers, and those tend to be, at least disproportionately, low-wage service workers. So they are not being protected by the lockdown measures. Meanwhile, the schools are closed, and their kids can't go to school, and yet they have to continue to work. School closures had a disproportionate effect on the less advantaged. That it was harmful to learning across the board, but the harms fell more heavily on school districts that were already low performing, that already featured wide learning gaps. Those grew wider. So you can go through each of the measures, and it has this character. Large businesses continued to do well, and in fact, in many cases, grew dramatically. You think about the growth of online retail. Meanwhile, small businesses shuttered, and many of them were never able to reopen. That there was a systematic class bias in the effect of these measures. It's probably one of the reasons why the measures were as sustainable as they were, in that they fell harder on people with less political power.
I know you described the decision making that occurred as selective life saving, that it cost one group, the expense of another. One group was able to be saved. And I wonder, is it not inevitable in such a large scale event that is going to take place?
It is inevitable in that, that we rely on human cooperation for our basic survival. And so that can't stop. So for the things that we need to keep on living, we need some share of people to keep on working. The question is, how those costs are going to be distributed. There was an alternative approach, which was to take what we knew about who was at most risk of disease, of severe outcomes, and ask them to take measures to protect themselves and to organize society to help protect them. That would have acknowledged that the virus is going to continue to spread, and that was very difficult politically for leaders to do. And so instead, they preferred to talk about containing it, suppressing it, stopping the whole thing, which, of course, the measures we were taking were never capable of doing that, given the large share of people who had to keep working. It was kind of a collective delusion. that we could protect everyone. We pretended that the lockdowns could protect everyone, even though it was quite obvious if you gave it any thought that they were not capable of protecting everyone. So a different strategy would have been to acknowledge that reality, that we lacked the technology to control this thing, and then to adjust our strategy to that reality.
Do you have any sympathy for the policymakers who had to determine whether they should be trying to save lives versus protecting the economy and saving livelihoods?
Well, I object to that framing, that's a little too simple. There are lives on both sides of the equation. That lockdown measures themselves have health costs. They haven't been as fully examined as the close analysis of the number of people who were catching COVID and dying from COVID on a daily basis during the pandemic. These are longer term costs, but unemployment has been shown to have effects on people, the length of time people live. The same thing with education. This is what's long been known in the field as the social determinants of health. And so measures that impose these kinds of harms on society will have health consequences over the long term. Not to mention questions around other types of care people needed to get during the pandemic. Routine care for chronic diseases. One thing that what we can see as we study the pandemic now is that excess mortality during the pandemic exceeds deaths from COVID. And there were rises in deaths from many other causes that outside the norm during that time period. Deaths from overdose, deaths from dementia and Alzheimer's. The nursing home care, the quality of that declined significantly when family members were not able to assist. So the range of society-wide costs is extraordinary. And requires us to do a lot of study and broader thinking than was being done during the pandemic. What we had during the pandemic was a tunnel vision on one kind of threat to human well-being, and the actions we took had collateral damage for human well-being more broadly.
It's interesting you talk about that tunnel vision and the other consequences, because it did create divisions in society. Tell me about what you described as moralized antagonism in the book.
Yes, that was certainly a characteristic of the politics around the pandemic in the United States. It became highly partisan. That as reopening began, it happens on party lines, so that Democratic states are slower to reopen businesses, slower to reopen schools than Republican states. And so that it overlaid what was already a pre-existing high level of party polarization. So there was a great deal of demonization of people with alternative views. A lot of geographic sorting of people with opposing views, so that residents of Democratic-leaning states simply saw alternative approaches as unthinkable, and those are bad people. So it was very moralistic, and I think that got in the way of taking on board information that could be obtained from looking at variation across the country in the COVID response and in the outcomes of that variation. In other words, as states reopened, the dire projections of the models simply weren't being borne out. Reopening schools, many parts of the U.S. reopened their schools in the fall of 2020. There was no crisis following that. And no evidence by the end of the whole period prior to the vaccine rollout that states that took a more stringent approach to the pandemic fared better than states that took a less stringent approach to the pandemic. At the end of December 2020, states are very similar in their cumulative COVID mortality rates, regardless of what measures they had taken.
I had noted you looked at that the party divisions along the state lines when it came to the policies and how they were handled. Is it possible to conclude then perhaps that Democrats were wrong and Republicans were right when it came down to lockdowns and strategy around lockdowns, but that perhaps it was the other way around when it came to vaccination?
So that is such a striking feature of the data, that if we track COVID mortality over the course of the pandemic, you can see that Democratic and Republican states look very similar up through the start of the vaccine rollout. But after the vaccine rollout began, you begin to see Democratic states where residents were much more excited to get vaccinated, much quicker to line up and get the vaccine. They begin to fare better. So that by the end of the time series that we analyze in the book, you can see that that Republican states have roughly 30% more COVID mortality than Democratic states. But all of that emerges all that difference emerges in the post-vaccine period. So you can certainly see that the Democrats who were eager to get vaccinated, that looks like a good decision for them. I mean, we are analyzing aggregate data. This is not randomized control trials. That's what we've got, to look back on. But we can see that in the pre-vaccine period, the different policies that states took don't correlate with the outcomes. But in the post-vaccine period, states with more vaccine uptake fared better.
Well, the Trump administration of the time did go along with the lockdowns at first. So at what point did the policy change? How and why? And why did it hand over the responsibility to the state governments in the end?
Well, in the U.S., in our federal system, the emergency powers that were needed to respond to the pandemic, in other words, the quarantine powers that officials possess, those lie at the state level. So it would have been highly controversial and contested had any president in the United States attempted to impose a nationwide lockdown. There was some discussion of it, but the legality of that was highly questionable. Meanwhile, governors unquestionably possessed those powers. And so the way the Trump administration handled that, on March the 16th, they recommended in a press conference that was carried live all across the U.S., they recommended that governors take these measures, which they then proceeded to do. Where you begin to see the polarization is in the reopening process, where Republican states began to reopen more quickly than Democratic states. Might also recall that President Trump in the summer of 2020 said that schools should reopen in the fall of 2020. And when he said that, there was a great deal of backlash. I mean, it's also important context to recognize that this was a presidential election year, and President Trump was running for re-election, very controversial president, and loathed by Democrats. I mean, always had very low approval rating among Democrats. So virtually anything he said would produce a backlash among Democrats. And so I think that helped to drive the highly partisan nature of the pandemic response in the U.S. The U.S. experience is different than other countries in that regard. It was not always so party polarized everywhere.
Well, Professor Lee, you and your co-author, Professor Steven Macedo, did a lot of deep research on this. And based on that, what do you believe has been the long-term damage to society as a result of the kind of policies that were enacted during the COVID pandemic?
Well, it exacerbated further the polarization that already existed in U.S. politics. It drove down trust in government officials and in science agencies. It has driven down trust in universities and among experts generally. It helps to drive a populist backlash that has characterized U.S. politics. The high inflation that was also downstream of many of the pandemic measures, the high level of spending without any corresponding increases in taxes that carried people through the pandemic closures, that's also had significant effects on U.S. politics. It will take time for trust to be rebuilt. And I think in order to rebuild that trust, we need to have a reckoning. We need to look back and acknowledge what we got right and what we got wrong, and come to some kind of shared societal understanding, if that is even possible in a country as polarized as the U.S.
Well, governments across the world, including the US, of course, had this unique opportunity to enact policies that would be unthinkable had it not been for something as severe as a global pandemic. And I wonder to what degree that there was possibly even a chance for governments to kind of test out their ability to enforce authoritarian measures, that and see and test the ground, if you like, on what might happen.
I mean, I'm sure this was a great learning opportunity for governments in terms of what is possible. You began to see a global effort to restrict uh, communications or control miscommunication or misinformation on social media in the context of the pandemic. Of course, the strong evidence that vaccines can protect people from severe disease and death, you can understand how they would want to protect people from conspiracy theories around vaccines, given their track record. But the effort to control misinformation extended way beyond vaccine misinformation to every aspect of the pandemic response. So I think governments learned from that. In the U.S., we learned that we can basically institute a nationwide universal basic income. That we basically had that during the pandemic. That it was extraordinary expansion of the social welfare safety net in the U.S. For a brief time, the U.S. looked a lot like Western Europe in its social provision. So it was a time of great governmental experimentation. And there certainly needs to be a look back, not just at what we can do, but what worked. What does the evidence suggest about the effectiveness of these measures? And of course, that also includes the effectiveness of efforts to control the spread of misinformation online.
I was in and out of the US quite a lot around the time of COVID. And post pandemic lockdown, it seemed that businesses struggled to get people back into the workforce for a long time. It seemed that literally no one wanted to work. And I wonder if there was an adjustment in society's attitude towards employment and certainly going into the workplace.
Yes, that it's a long tail on these pandemic measures. And, getting people to, go back to work has been difficult everywhere. I mean, in the context of the U.S., in many cases, people just accelerated their retirement. They're not going back. So that's been a feature of the post-pandemic economy. It's also been a feature of post-pandemic schooling, that chronic absenteeism has just exploded. It roughly doubled nationwide in the U.S., and you see the same pattern in other countries as well. So it's not just that people didn't want to go back to work, they also didn't want to go back to school.
That's quite remarkable. Were you surprised, though, when the lockdowns were enacted at how compliant so many societies around the world seemed to be when it came to obeying the rules?
I was surprised at the extent of compliance. I mean, especially here in the U.S., it's a very individualistic society. I wouldn't have thought ex ante that there would be the degree of compliance that we saw. Now, it was, of course, an imperfect compliance at all times. I remember in the first week of the lockdowns, I was living in Washington, D.C., and I could hear some people out on the street partying late at night, one of those nights during that first week, and thinking to myself, I don't think this is really going to work. But even with that said, you could see streets were empty. People were, to a very great degree, staying home. I mean, I just wouldn't have thought that was possible. So it was an extraordinary time.
And it seems that the research that you and your co-author, Professor Steven Macedo, have done seems to indicate that these non-pharmaceutical interventions had no real life-saving benefit in terms of the actions that were taken. So what would have been the alternatives, in your opinion?
Well, the alternative would have been to advise people about what was known about their risks. That, to let people know how the disease is transmitted, at least what was known about it. I mean, that, of course, that's one of the many questions that scientists had to confront, that they simply didn't know for sure how COVID was transmitted. And so it's really impossible to design an ideal strategy in response to a disease where you don't even know for sure how it is transmitted, whether it was through surfaces or whether through its droplets or whether it was aerosolized. All of that was uncertain. But to sort of in other words, tell tell it to the people straight. You know, don't indulge in noble lies. Don't try to tell people what you want them to think. Tell them the truth. I think policymakers would have stood themselves in much better stead had they been more frank with the public about what they knew and what they didn't know, that these measures hadn't been tried. We think, at least if you stay away from other people, you won't catch this. Like, just tell people what you know. And then be ready to take on board new information. I think it would have been a much sounder strategy in the long run.
But there were no historical comparisons for the COVID-19 pandemic, were there? Nothing near that.
Well, I mean, the 1918 pandemic is a long time ago. And it happened at a time where it was simply not possible for any significant segment of societies to stay home. So you could stop large gatherings, stop parades and theaters and that sort of thing, but that's about all you could do during that time, and some places did that. Now we've had other pandemics in the 20th century. They were not as severe. So 1957, 1968. And during those pandemics, there had been no recommendations to try to take measures to slow the spread of the disease. So I think some acknowledgement that we just didn't know for sure what would work would have been in order. I mean, there was a lot of reasons to think that these measures wouldn't work, beginning with the fact that such a large share of the workforce had to keep on working, and that so many residents of every society are dependent on others for their needs, elderly and young people, and so they can't be separated. And so that the sort of the recognition that we lacked a technology to stamp this thing out, to contain it, especially after it had spread widely. This is, I think, a very important question. Why weren't governments eager to find out how far the disease had spread early in 2020? That you would have thought that they should have launched seroprevalence studies, random testing, to find out how many people had been exposed. As we look back here in the U.S., there is evidence in blood banks that COVID had been spreading in the U.S. In 2019. There are samples in blood banks from 2019 that indicate COVID antibodies and having been exposed. So we'd had no idea how long it had even been spreading, but certainly these measures would not be effective if the disease was widely disseminated already in the society.
Well, of course, it's very hard to make historical comparisons because we live in a time where people can travel so easily and so quickly at a global level. Plus, there's information spreading by the microsecond. So, of course, anything is different. But, of course, we have an AI age upon us. And I wonder how that would change things, because people seem to have a bit more faith in what AI says. It kind of almost takes the politicians and scientists out of the equation to some degree. I wonder if that's going to have any factor or be a factor when it comes to any future such infection.
That's a question I hesitate to tread in answer to that question. I mean, I think as someone who does research for my job, I have found that as of yet AI can be helpful, but you have to check its work. I certainly wouldn't if I were advising people in society generally. I would not recommend that they take any AI's word for it.
Well, Professor Lee, you and Professor Macedo, with your book, have put the magnifying glass on this pandemic that we all endured at a global level so recently. What do you think, realistically, having discovered so much, what do you think realistically would or could be done differently? God forbid another infection like this spreads.
Well, obviously, all through the pandemic, there was standing there the Swedish example where government officials shared with the people what they knew, and recommended that they take actions, but did not impose society-wide closures, border closures. They declined to close schools for people under age 16. They did not impose mask mandates, nor in fact did they recommend masking for society generally, given the quality of the evidence that they had. So an advisory approach, given the level of uncertainty around what works under these conditions. And as you pointed to just moments ago, the speed with which these diseases can spread widely, given how fast we travel today, sort of a recognition that's just the reality of the lives we lead today, that it's very fast moving. And that in that context, we have to acknowledge limits around what is reasonable. What can we reasonably accomplish here? And in that context, tell people what you know and let them in their own lives make adjustments. And you can take measures to help those at most risk, but a law enforcement approach, these mandatory actions, the evidence that they worked is poor. So under those conditions, I think government ought to hesitate to impose mandates if you don't know for sure that they're going to work.
Professor Frances Lee, thank you for such a fascinating perspective on the COVID pandemic. Really appreciate the time.
Thank you very much.
Professor Frances Lee there. Next up is Professor Steven Macedo, the co-author of In COVID's Wake. We'll explore how the pandemic polarized politics and led to a lack of trust in experts, and how mainstream and social media responded to the crisis. We'll also consider what, if any, lessons have been learned from the COVID-19 pandemic. Professor Steven Macedo, thank you very much for making the time. Now, when it comes to the COVID pandemic, everyone has a view. So when researching and writing your book, how did you make sure that your own personal and political views didn't influence the book?
Well, we did quite a lot of research. I mean, I think that was the main, effort there. And I will say that I did not start off with the views that wind up being advanced in the book. I did not expect to find as much doubt expressed in pre-COVID pandemic documents about the measures that were pursued. I didn't expect to find the amount of messaging from public health officials that didn't seem to be entirely accurate. And insofar as we arrive at conclusions that are critical of government measures and democratic states measures in the United States, these were not things I anticipated, particularly when I went into the book. So we had no trouble finding critics along the way, critics of our view, people that doubted what we said, because most of our colleagues began, as we did, by being skeptical about some of the claims that we advanced in the book.
And of course, the COVID pandemic hit at a time of deepening divisions as President Trump's administration polarized opponents and supporters. So how did that play out when it came to the response in the USA?
Yes, I think that was a major factor. I think the United States is an extremely polarized society, more so than other Western European countries in comparison. And 2020 was an election year. So the pandemic really arrived in February and March 2020. For a time, there was a period when all of the states acted in unity to close their schools. Schools closed across the entire United States very quickly. And business closures and lockdowns likewise took place almost uniformly across the entire country for 4 to 6, maybe 8 weeks. But then as spring and summer began, the states dominated by the Republicans on the one side and the Democrats on the other side diverged in their approaches, with Republican states opening much more quickly, Democratic states keeping their lockdowns in place much longer. And in particular, when the fall came around, many schools in Republican states tended to open. In Florida, in fact, Governor Ron DeSantis mandated that all of the schools in the state should be open, whereas Democratic states kept their schools closed through much of the 2020-21 school year, or indeed all of that year. So there was a major divide that emerged by party in terms of the stringency of the pandemic response, the imposition of non-pharmaceutical interventions. And then, of course, the rhetoric was very intense and became extremely angry And I think that's partly because President Trump became associated with the side arguing to reopen the economy and let people move about more freely, more skeptical about the severity of the virus, perhaps. And so it took on a very strong partisan, polarized inflection, the debate did in the United States.
Well, under those circumstances, isn't it inevitable that the big event of the day would become polarized and politicized?
Yes, I think that's probably true. At the time, perhaps we didn't realize the extent to which that would occur. But in retrospect, I think it's not surprising. Uh, President Trump is a uniquely divisive figure, but the country is polarized in any case. He was on the ballot. I think the news media, in part, had worried that they had contributed to his victory previously in 2016 by paying attention. Maybe they felt then too much to Hillary Clinton laptop issue and other issues that gave him some support. And there's even some evidence now that those who are developing the vaccines might have slowed down their development a little bit so that he would not be able to claim credit for them going into the 2020 election. That's not something we focus on in the book, but there's some messaging that some people involved seem to have suggested that. So it was very politicized, very polarized, and worse in the United States than elsewhere. I think European countries tended to reopen their schools in the fall of 2020, in part because the debate was less polarized, and in part because people were more willing to learn as more evidence that became available that schools were not significant sources of virus transmission. But it took progressive states a long time to learn that lesson in the United States, because I think it wasn't a message that was appealing from a partisan standpoint, where they associated school reopening with the Republican Party.
And of course, the term follow the science became quite widely used during the pandemic. Now, initially, people on both sides of the divide generally trusted health officials. What changed?
Well, I mean, I think a number of things changed. Partly, it became clear that the scientific establishment was not being altogether frank about various things. I mean, I would identify first the origins of the virus. The virus emerged in Wuhan, in Hubei province in China, and Wuhan is home to China's leading bat coronavirus research institute. On the other hand, China has many live animal markets, and yet, after there were some suggestions that the virus might have leaked from the Wuhan lab, the scientific establishment swung into action very quickly to try to suppress that idea, to try to cut off debate about it. The evidence rather suggests, and to push the argument that it had to have arisen in nature. And I think that was deeply implausible to people. And the evidence was always mixed, and it was always at least a reasonable hypothesis that the virus might have emerged in the lab. And yet it was being called a racist conspiracy theory. I think that was something that people could see was rather absurd. I mean, it's absurd to suggest it's more racist to say that the virus came from a lab in Wuhan than came from a market in Wuhan where the Chinese get live animals to eat. So that was one thing. And then I think the social distancing measures, well, including the masks, there was a lot of mixed messaging around masks. Don't wear them. Wear them. You must wear them. They became mandatory in various places. And of course, there was a lot of scientific doubt about the effectiveness of masks. And then the lockdowns themselves had aspects that I think people could see were palpably absurd, about not allowing people to be outside, restrictions on outside movement, going to the beach, sort of severe limitations on outdoor recreation that didn't seem particularly rational. And I think there were certainly many that were willing and eager to go along with those measures, but there were other people that made different judgments, and I think felt reasonably that science was the public health officials were going beyond what the evidence would have supported. And then finally, there was some mixed messaging around vaccines. We're not vaccine skeptics. Vaccines were game changers for the elderly and vulnerable. But there were suggestions that the vaccine would be sterilizing, that you would be a dead end to the virus once you had a vaccine, that you couldn't pass it on. Well, the virus, COVID trials, the vaccine trials, did not test for that outcome. So there was no basis for saying that. And of course, it soon became clear that while the vaccines were very effective at preventing most people from getting seriously ill or dying from COVID, it didn't prevent them from contracting COVID and passing it on. So I think there were a bunch of different ways in which scientific messaging was not as frank and nuanced, not as honest as it should have been. I guess I'd mention one other thing, which is about the vaccines. The message was being pushed in many places that you would not get immunity from contracting the virus and recovering. The World Health Organization actually changed the definition of herd immunity on its website over the summer of 2020 from saying that it was that herd immunity or population level immunity could be gotten from people either getting vaccinated or getting the virus and recovering. And they changed it over the summer of 2020 to say herd immunity came from vaccination, period. And I think the reason why they did that was to discourage people from contracting the vaccine and encourage them to wait for the discourage people from getting the virus, encouraging them to wait for the vaccine, which was fine. But that was a misleading message that had nothing to do with well-established science. So there are a variety of ways in which scientists and public health officials seem to be not telling the whole truth, and indeed, in such a way, often is to manipulate the public. And I think the public had reason to feel disrespected and as though they had not been told the whole truth.
How did it get to a point where a figure such as President Trump's former medical advisor, Dr. Anthony Fauci, became someone who was loved and loathed in equal measure?
Well, that's a long story and it's a tough one. I mean, he certainly participated in some of the mixed messages around masking. In 2019, just before COVID, not long before COVID at all, he participated in an interview with a medical reporter who began to ask him, with no knowledge of COVID on the horizon, suppose there's another pandemic, what should we do? Should we wear masks? And Dr. Fauci immediately cut him off and said, no, avoid that paranoid stuff. Just keep healthy, get a good night's sleep, don't drink too much, do the normal healthy things. And so, that was 2019. And then lo and behold, masking became something that he supported, at least after a time. There have also been suggestions. He also made some of these claims about being a dead end to the vaccine, I believe. And then too, he's apparently, at least some evidence suggests and people suggest that he played a role in deflecting attention from the possibility that the virus originated in the Wuhan lab. And there are suggestions that may have been in part because U.S. government funded research in that Wuhan lab on gain-of-function research on coronaviruses, not necessarily this particular virus, but funded related research. So while part of the motivation for that may have been a desire to retain the trust of the Chinese and not introduce a divisive discussion into the pandemic in February 2020, there may have been reasons of self-interest as well. That's a story that's just unfolding. So there were various grounds for wondering whether he was being entirely frank with the public.
When President Trump suggested that sunlight and injecting disinfectant could help to combat the virus, his comments were roundly condemned by the medical community and ridiculed in the media. What impact did those comments have and the response to them on the levels of trust?
Well, it's fair enough. I mean, President Trump was very inconsistent. His press conferences, I think, were very ill-considered, speaking off the cuff that way in a kind of a non-serious way. I think he lent a sense of chaos to the what should have been a very serious situation. People should have been speaking who had greater expertise, and I do think everyone should have spoken with greater frankness. But there's no question that he is a uniquely divisive figure in American politics, and people had concerns about his motivations with respect to getting the economy open. He wanted the economy to be strong, going into the election. So there were suspicions that it was that was perhaps motivating him rather than public health considerations, though his instincts, turn out perhaps to have been not entirely wrong. So I definitely think he played a role. He's not always wrong, but he often presents his views in ways that are not designed to persuade people of their rational basis. So he definitely played a role.
What do you believe the role of the mainstream media should be during an event such as a major pandemic, and how well did the media fulfill its role when it came to COVID-19?
Well, I think the media performance under COVID does need to be reexamined and leaves something to be desired in various ways. What we find is that in many ways the mainstream media, the elite media was very much on the side of the scientists who, in approaching COVID, really focused on one outcome only, and that was reducing deaths from disease, reducing the transmission of COVID, and reducing disease spread. Perhaps that's understandable early on, but as we went through the summer of 2020 and into the fall, it should have been clear that we were learning things about people's vulnerability, that they were very unevenly vulnerable, and we should have been paying more attention to what was obvious from the start, which is that the interventions that were put in place to slow the spread of COVID, the non-pharmaceutical interventions, would be very costly, and not just costly in economic terms, but costly for children's education, children's well-being at a fundamental level, and human well-being at a fundamental level. These things were pointed out in the pre-COVID pandemic plans. And yet the media constantly asked why more wasn't being done, why a national lockdown wasn't being contemplated, why the lockdowns were not more stringent and kept in place longer. So the media took the side of many, and focusing only on the stringency of lockdowns and not paying paying very little attention to the costs of these measures. And that was a fundamental point of irrationality in our approach. We should have known from the start the lessons of the pre-COVID pandemic plans, that these measures were of a very uncertain effectiveness and certain costliness. That's the message of the pre-COVID pandemic plans. And unfortunately, it's something that was largely ignored, certainly in the early parts of the pandemic and for a very long time after.
How do you judge the role of social media during that time?
Well, that's a tricky one. I didn't follow social media particularly on this, but one thing we do know is that, of course, social media can be a way of transmitting misinformation as well as information. And certainly there was a tremendous concern with that during COVID. So what we now know is that the Biden administration was in touch with the social media companies, pressuring them to suppress postings, messaging that was at odds with administration policy, and that the social media companies in general complied. And this was all behind the scenes. The public was not aware that this was taking place. And we have the emails and communications between Biden administration officials and the social media companies. And in some cases, they were pressured, the social media companies, to suppress postings that were true concerning, small numbers of side effects from vaccines. The pressuring was on the ground that it was thought that this would be unhelpful, even if it was true. But there was also messaging related to the election that was suppressed. Now, in retrospect, Mark Zuckerberg and others have expressed regret about this. People have suggested that he's done that in order to curry favor with the Trump administration. But I think there's good reason for the social media companies to feel that they did not play their proper role in their across the board compliance with this. So I have to say that while there's legitimate concern with misinformation and disinformation on the internet, but I'm not confident that we should put in governments the power to decide what is misinformation, and I certainly shouldn't have the power to secretly pressure social media companies into suppressing messaging that the government considers to be misinformation. We quote sources in the book from the Journal of the American Medical Association, an article that was published in August 2023 about doctors spreading misinformation on their social media accounts. And among the things that article, published in the Journal of the American Medical Association, calls misinformation are things that we know and should have been known at the time in 2023 to either be true or perfectly reasonable, like that the virus might have originated in Wuhan, like that natural infection, getting the virus and recovering, contributes to immunity. The article classifies those as misinformation. It also classifies as misinformation suggestions that public health officials misled the public. Well, public health officials have admitted to misleading the public. They had admitted to misleading the public by the time this article was published. So we have to be very careful about according governments the authority to decide what the truth is, because they don't have a good record on that. And frankly, they don't have a particularly good record on it under COVID.
Professor, to what degree do you think that the misinformation, disinformation, conspiracy theories, and echo chambers that we see on social media today are a result of the polarization that occurred during the pandemic period?
Well, there's no question that we went into the pandemic polarized, but it does seem to have exacerbated things. That is true. The response of the 50 states was highly polarized. It was the red states opened much more quickly than the blue states. The kind of discussion that was taking place in the blue states was very much, I think, partly shaped by being opposed to what was taking place in the red states. And perhaps most depressingly, there's been very little learning across the partisan divide. One thing that we saw as governors stood for re-election after the initial period of the COVID pandemic, in spite of the fact that they pursued very different policies across the 50 states, Republicans and Democrats, and in spite of the fact that there's been very little evidence that the lockdowns had the intended effect, but were certainly costly. In spite of all that, the governors were almost uniformly reelected, both Democrats and Republicans. So I think we're starting to learn some things, but so far, I think the extent of partisanship has been one of the factors that has impeded learning, because I think, frankly, a lot of journalists, academics, and certainly public officials are reluctant to ask questions that might seem to give aid and comfort to the other side. I think that's one of the things, along with the trauma of COVID itself and not wanting to think back on that period. I think the partisan aspect has also been something that has so far derailed a serious reckoning about what happened and what we should learn from it.
So it sounds like there's a clear distinction when it came to wearing masks, social distancing, and even ultimately vaccines, that depending on the political alignment, people behaved with those interventions accordingly.
Yes, that's correct. The lockdowns, mask mandates, and so on were more stringent, more tough, more long-lasting in Democratic states. And the evidence also suggests that there was more compliance with these measures in Democratic states. People's cell phone data and so on shows more of a fall off in movement in Democratic states than in Republican states. So it's true. People arrived at different, it seems, value judgments about the risks of the virus and their willingness to sacrifice for the sake of avoiding those risks in different places. And I think that's one of the things we should recognize is that COVID policy from beginning to end was never a matter of following the science. There are always value judgments involved about risks and trade-offs. And people differ with respect to those value judgments. Partly they differ on partisan grounds, but they differ on other grounds as well. And I don't think we had enough respect for that. I think the discussions emphasizing follow the science never recognized the important place of value judgments and trade-offs in making those policies. There should have been more open discussion about the value trade-offs that were underlying all of these policies. Not being able to have a funeral, not being able to visit a loved one in a nursing home. I mean, there were reasons for social distancing restrictions, as it turns out, perhaps not great reasons, but things that at the time may have been perceived to be reasonable. But there were always value judgments, and those should have been weighed.
There was also some kind of provocative input into this when President Trump called COVID-19 the China virus and made such references with, of course, the references to the lab and so on. Was that to some degree deflection on his part, trying to avoid criticism of his administration?
Well, it might have been. It might have been. And certainly that kind of rhetoric was not at all helpful. There were reasonable grounds, as I mentioned before, for suspecting that the virus may have spilled from or even been manipulated by the lab in Wuhan. The virus did originate there, and there is a very important bat coronavirus research institute in that town, as it turns out. So there were some grounds for that, but obviously it was a suggestion that should have been advanced in a sober way. And those kinds of rhetorical flourishes, which he is so fond of, can be very unhelpful, and certainly was in the case of a situation of desperate importance, as COVID was. So that kind of messaging was not helpful, for sure.
Do you think there was a cover-up ultimately? Do we even really know what the true cause was?
Well, I think more and more information is coming out. Cover up is a big phrase to use, but looking at the record and paying careful attention to the emails that have come out, to the additional information that's being published in various places, I would recommend a news site called US Right to Know, which has done a number of freedom of information requests on this and published some very good articles, basically just publishing the emails that we have from the scientists and others. It does seem to me that the likelihood is that it emerged from the lab in Wuhan, perhaps by a spill or perhaps manipulated. There are definite signs of a manipulated virus. There's very little question about that. We've learned quite recently that early on, German intelligence officials informed Angela Merkel that the virus had a lab origin with high likelihood. I believe they said 80 to 95% certainty. And the other thing that's been suggested is that if people did think it emerged from the lab, that would have been one of the reasons for imposing these stringent lockdowns very early, because a manipulated virus might have been manipulated. This is the point of gain of function research, to make it more transmissible among humans, meaning that some public officials may have been aware, without letting the rest of us know, that this was liable to be a virus, that this was a virus that was going to be extremely unusually highly transmissible among humans. And therefore, that could have been one of the reasons for these stringent lockdowns, which we weren't aware of at the time.
Now, you say that when COVID showed up, public health officials developed tunnel vision. In what way?
Well, when we look back at these pre-COVID pandemic plans, the two emphatic messages, or the three emphatic messages, are these measures, lockdown, school closures, have a weak evidentiary base in terms of effectiveness. We're not at all sure that they work. The evidence for them is poor. However, we are confident that if they are imposed for any sustained amount of time, they will be costly. And further, those plans emphasize public officials will nevertheless be tempted to use these measures to show that they're in charge, to show that they're in control. And therefore, public health officials must be frank with the public about the uncertainty of the effectiveness and the certainty of the costs. And this is why it's so unfortunate in retrospect that public health officials and politicians, in many cases, simply focused in making their policies on COVID on reducing deaths from the disease and reducing disease spread. Obviously, deaths from COVID is a very bad outcome, but there were the policies themselves were also generating very bad outcomes in terms of medical tests being postponed, visits to hospitals and doctors' offices being postponed for a considerable amount of time. Fear, the closing of small businesses and other businesses also has health effects. There's a big literature on the social determinants of health. So there were many more consequences that should have been considered. And yet we can see, looking back, that there was a tunnel vision focused simply on disease spread and minimizing deaths from COVID, when other serious costs should also have been taken into account.
What do you think have been the long-lasting results? What's been the long-term impact on human mental health, on behavior, education, and so on, as a result of the lockdowns?
Well, there's considerable evidence for very serious knock-on effects from these measures: increased depression and learning losses among children that are severe and that appear to be long lasting, that are not being made up for economic concerns and losses in terms of closures of small businesses. And beyond that, too, I think a greater distrust in science and public health officials, a greater distrust in expertise in public messaging. So we have a long chapter on costs in the book, and they are many and wide-ranging. And I think the loss of trust in science and public health are among them, and that will not be easy to restore. So I do think it's time for a reckoning about all these matters, an honest reckoning in which educated elites take a self-critical look at what we did right, but also what we did wrong and how we can do better.
On that point, the UK is in the midst of a wide-ranging independent review of its handling of the COVID crisis. Other countries are doing the same. Why hasn't there been any such kind of review enacted in the USA?
I think because of lack of bipartisan buy-in. There was a very good committee in the House of Representatives, the House Select Committee on the Origins of the Coronavirus. That was something that was advanced by Republicans in the House. Congressman Brad Wenstrup of Ohio chaired that committee. I thought they did a good job, basically, digging for the truth about the origins of the virus, an issue we talked about a minute ago. Democrats participated a bit, but often seemed more interested in making partisan points in the course of that committee hearing. I think that's unfortunate. It's too important a question to simply regard from a partisan standpoint. So I think that's played a big role. The extent of partisanship and the extent to which people are afraid of asking questions that might seem to put them at a partisan disadvantage. It's really unfortunate. We hope that our book contributes to this kind of reassessment and to a reckoning, but so far it's not taken place at the national level.
Well, in absence of that kind of political collaboration and cooperation resulting in no review, what do you think are the main lessons that should be learned?
Well, I think there are a variety of main lessons. One is that decisions about pandemics, policy decisions about pandemics, involve a lot more than virology and epidemiology and narrow public health expertise. And those decisions should be made by people that hold political office, by governors, executives, legislatures, and should be made on the basis of the whole range of considerations that are relevant to the public good. So too much power was yielded or accorded to narrow public health experts. There needed to be wider public input and a much wider consideration of all the values relevant to these decisions. So we gave too much power to narrow experts. A wider group of experts should have been consulted, economists, sociologists, and others, not just epidemiologists and virologists. But I think the public should have been involved too, both directly and through the legislative branch. Legislatures representing the people should have played more of a role in asking questions, in being skeptical, frankly, and chiding the experts and getting them to explain and to consider alternatives. So there needs to be a much wider set of public deliberation on this. And then finally, we also just need to be more modest, honest, and acknowledging the limits of our knowledge, the uncertainty around these matters. The science on the non-pharmaceutical interventions was not clear. There was not a good evidentiary base to assert that these things were bound to be effective, and there was too much hubris, sense that we could control this. So I think we need to acknowledge the extent of our ignorance to a greater extent, and also the fact that there are differences of judgment and value out there that should be respected, differences of opinion, including across the partisan divide, that deserve greater respect than we accorded them under COVID.
A final thought, Professor. In a nutshell, what was your personal biggest takeaway from the COVID experience?
Well, I was, a bit late coming to the views that I've come to. I was living in a blue state, and I complied with the measures, and I assumed, for the most part, that they were well-founded. So I think we need a much wider public discussion. It turns out, I'm not a public health person. I'm a political scientist, political theorist, social theorist. But there's plenty of information out there that's perfectly accessible we need wider public conversation about these matters. We shouldn't have concluded that this was a, kind of a scientific question to be decided by experts. A wider public conversation about these matters is called for. I think the other thing that I would take away is that we're very vulnerable to a narrowness of thinking in these kinds of existential crises. Fear played an enormous role. I think we need to try to stand back and be a bit more rational. We count on public health officials to help us with that, but what we need to be very more cognizant of the ways in which both fear and partisanship can distort our thinking. And certainly as an academic, I think I'm more prone to be worry about the effects of groupthink, that there's a tendency for intellectuals, academics, to form a collective view, and again, not to take seriously enough critics of what seems like the common wisdom.
Professor Steven Macedo, thank you very much for your time, sir.
Thank you.
Well, the book, In COVID's Wake, How Our Politics Failed Us, is available now. And we'd like to thank its co-authors, Steven Macedo and Francis Lee, both professors at Princeton University in the USA. And that's all for this episode of The Riz Khan Show. From me and the team, thanks for watching. We'll see you soon.